If you take amlodipine for blood pressure, go look in your fruit bowl. Go on, I will wait. If you are over 60 and you take that pill, odds are there is a grapefruit in there gone untouched, slowly turning into a science experiment, because at some point somebody told you the thing was dangerous and you have treated it like a hand grenade with a rind on it ever since. And fair enough, somebody scared you. Maybe the pharmacist, maybe that little folded paper stapled to the bag, the one nobody reads except the one time it makes your stomach drop. Do not eat grapefruit, not with your pill. So if you take amlodipine, sometimes called Norvasc, you have almost certainly caught some version of that lecture. It is one of the most common blood pressure pills going, and one of the most commonly prescribed to seniors and older adults, which means a whole lot of people and a whole lot of innocent grapefruit dying alone on the counter. Here's the part that is going to bug you. The warning is real. It is just that most of what you were told about how it applies to you is probably wrong. Some folks on a blood pressure pill genuinely are playing with fire every time they reach for that fruit. Others got scared off for no reason at all, and nobody ever bothered to tell you which one you are. There is also a second thing. A combination sitting in a lot of medicine cabinets right now, amlodipine plus one other extremely ordinary pill, that deserves your attention far more than the fruit ever did. Almost nobody warns you about that one. We will get there. So let us untangle the whole mess. Part 1. The grapefruit myth. Which pill grapefruit is actually dangerous with, whether yours made the list, and the quiet little combination that matters more than any of it. Stick with me, because by the end you are going to know exactly which bowl that grapefruit belongs in, the trash or the table. Let me back up and explain the whole thing, because once you get why this happens, the rest of it just clicks. Deep in the wall of your gut and up in your liver, you have got a little enzyme with a very boring name. It is called CYP3A4. Do not worry about the name. Think of it as a bouncer. Its whole job is to stand at the door and break down a big chunk of whatever pills you swallow before they ever make it into your bloodstream. It is quietly working the door on more than 60% of the prescription drugs out there. Most of your life you have no idea it is even back there, doing its thing. There is also a related transport mechanism called P-glycoprotein working alongside it, but the bouncer is the main one that matters for this story. Now, grapefruit. Grapefruit is full of these compounds called furanocoumarins, and the main one doing the damage is a compound called bergamottin. What they do is walk up to the bouncer and knock him out cold, just lays him flat. And with the bouncer down, the door is wide open. So a drug that was supposed to trickle into you slowly instead comes flooding through. And suddenly you have got way more of it in your blood than anybody intended. That is the entire trick. That is why one innocent-looking piece of fruit can turn a normal dose into an overdose. And here is the mean little detail. That bouncer stays knocked out for a day, sometimes longer. So you cannot outsmart it by having your grapefruit at breakfast and your pill at night. Does not work. The door stays open all day. Here's the twist I promised you. Amlodipine, brand name Norvasc, is technically part of the family of drugs called calcium channel blockers that uses that bouncer. On paper, it should be sitting right in the danger zone. So a while back, some scientists went and actually checked. Real study, 20 healthy men, grapefruit juice every single day, the works. And amlodipine just sort of shrugged the whole thing off. No meaningful jump in the blood, no real change in blood pressure. Other studies landed around a 15% bump, which for a blood pressure pill is basically a rounding error, and the reason is almost funny. Amlodipine is already very good at getting into you on its own. It does not really lean on that gut bouncer to begin with, so knocking the bouncer out does not change much of anything. The door being open does not matter a whole lot when your pill was climbing through the window the whole time anyway. So if amlodipine is your pill, that sad soft grapefruit you have been avoiding for 2 years, it was probably innocent this entire time. Now, I am not handing you a license to go drink a bucket of grapefruit juice with every meal, and people are built a little differently, so common sense applies. But a grapefruit with breakfast is not the hand grenade somebody sold you. This is the part that actually matters, so stay with me. That grapefruit warning is not nonsense. It is deadly serious. It just got printed for the cousins. Amlodipine has relatives. Felodipine, nifedipine, also sold under the brand name Procardia. Nisoldipine. Same family of calcium channel blockers, names that all sort of rhyme, easy to mix up. But unlike amlodipine, these ones lean hard on that gut bouncer. They depend on him. So when grapefruit knocks him out, their levels do not tick up 15%. They double, sometimes triple. The people who make nifedipine and nisoldipine come right out and say it on the label. Avoid grapefruit, full stop. And that is a real your pressure drops through the floor, room starts spinning, better be near a chair situation. That is a fall. And a fall, after a certain age, is the thing that changes everything. So here is what happened to you. The warning got written for the whole family, and you, sitting there on your amlodipine, got handed the scary version that was really meant for your cousins. You inherited somebody else's fear, which means your homework tonight is embarrassingly simple. Go read the bottle. Actually read it. If the name ends in that dipine sound, but it is not amlodipine, if it is felodipine, or nifedipine, or nisoldipine, then the grapefruit warning has got your name on it, and you should take it seriously. And if it says amlodipine, you can let your shoulders down. A lot of people genuinely do not know which one they take. They just know it is the blood pressure one. Tonight is a good night to find out. Part 2, the real danger. Okay, here's the part I actually wanted to sit you down for. Forget the fruit for a second. The thing that deserves your attention is not something you eat with amlodipine at all. It is another pill. A pill a whole lot of you are already taking right next to it. A cholesterol pill, a statin, and one in particular called simvastatin, sold under the brand name Zocor. Here's the quiet irony of the whole thing. Remember that bouncer? Amlodipine itself is a mild version of the same thing that grapefruit does. It gives the bouncer a little shove. Nothing dramatic, but enough. So, amlodipine ends up doing to simvastatin roughly what grapefruit does to those cousin drugs. It lets too much of the statin pile up in your system. Put the two in the same body and simvastatin levels climb by around 77%. And too much statin does not show up as a stomach ache. It shows up in your muscles. Aching, weakness, the kind of heavy, sore all over feeling that is very, very easy to write off as just getting older. And in the rare bad cases, it turns into a thing called rhabdomyolysis, where muscle tissue actually starts to break down. When that happens, a protein called myoglobin spills into your blood, and your kidneys, which have to filter all of that out, can take a real hit. Doctors will check something called creatine kinase, or CK, in your blood if they suspect this is happening, because it shoots up when muscle is breaking down. That is a hospital, and for older adults, it can mean acute kidney injury on top of everything else. This is real enough that the FDA drew a hard line in the sand. If you take amlodipine, your simvastatin is not supposed to go above 20 milligrams a day, and they did not pull that out of thin air. When they looked at the reports, the higher doses of simvastatin paired with amlodipine had noticeably more of those muscle breakdown cases than the 20 milligram dose did. The line is there for a reason. So, second piece of homework, and this one might matter more than anything else I am telling you. If you take amlodipine, and you also take simvastatin, go look at the number on that statin bottle. 20 milligrams or under, you are sitting inside the line where you belong. 40 or 80, and that is not a reason to panic, and it is absolutely not a reason to stop taking anything on your own. It is a reason to call your doctor and ask one simple question. I am on amlodipine and 40 milligrams of simvastatin. Is that still the right dose for me? That is it. That is the whole conversation. And one more useful wrinkle, because I do not want to scare you off statins. There is another extremely common one called atorvastatin, also known as Lipitor, and it does not carry that same limit with amlodipine. Different pill, different behavior. So this is really a simvastatin story, not a statin story, and knowing that difference is worth a lot. You want to hear the funny part? That grapefruit. The one you just let off the hook for your amlodipine. It is not off the hook for your statin. Grapefruit plus simvastatin is a genuinely enormous interaction. We are not talking 15% here. We are talking the statin levels going up many times over. Same story with its close relative lovastatin. So the fruit really was dangerous. It was just standing next to the wrong suspect the whole time. If you are on simvastatin or lovastatin, then yes, go easy on the grapefruit for real. If you are on amlodipine and nothing else, you can relax about it. Two more true things about amlodipine, fast, because these are more useful than any fruit. First, if your ankles and feet puff up on amlodipine, that is a common and usually harmless side effect of the pill itself. It is not something you ate. It is worth mentioning to your doctor, but it is not a mystery, and it is not the grapefruit. Second, and this is the real one to watch, alcohol. Amlodipine lowers your blood pressure. Alcohol also lowers your blood pressure. Stack the two, and you can get lightheaded, and lightheaded at our age is how people end up on the floor. So if you are going to have a drink, know that your pill is already doing some of that work, and stand up slowly. So, let us go back to that grapefruit going soft in your bowl. Trash or table? If your pill is amlodipine, sometimes called Norvasc, and only amlodipine, then that grapefruit belongs on the table. Slice it up, salt it if you are one of those people, enjoy it. It was never your enemy. If your pill is one of the cousins, felodipine, nifedipine, nisoldipine, then it belongs in the trash, or at the very least in a real conversation with your pharmacist. And no matter which blood pressure pill you take, if there is a bottle of simvastatin sitting in that same cabinet, the thing to check is not the fruit at all. It is the number on the statin. None of this is me telling you to ignore your doctor. It is the opposite. It is me telling you to walk in there actually knowing which warning is yours, instead of being scared of the wrong thing for another 2 years. Read your bottles tonight. Ask your pharmacist the one question that fits your situation. And please, never change a dose on your own. If this cleared something up for you, stick around, because the next thing sitting in most medicine cabinets is one I really do want to walk you through. Take care of yourself and go deal with that grapefruit.